Yeah, Idi Stewart is our guest because the last cremation I went to um, at Caroni a couple of weeks ago, there was a pira, and it was extremely small, and it was a cremation for a 1 day old baby, and that broke everyone's heart as they carried her to the pira to be cremated.
Morning, Idi.
Morning to Idi Stewart.
A pleasant morning to the team, and pleasant morning to your listeners.
Thank you for joining us this early. We appreciate you being with us. We're just relaying the concerns about the situation regarding the 7 babies at Port of Spain General Hospital. Can you give us an overview and or update, please, from where you sit?
From the association standpoint, look, we also want to extend our thoughts and prayers to the relatives of those 7 babies. And also we would want to sympathize because we know the medical and nursing staff are also going through some psychological distress themselves. They are some of the most committed and emotionally involved persons. When you're dealing with babies, you could understand you getting attached to those babies. So those neonatal nurses and pediatric nurses are some of the most caring nurses we have. So we know they are going through some psychological distress right now. So our thoughts are with them. Now, the association must appreciate that nosocomial infections are unfortunately commonplace within hospital settings. These hospital-acquired infections, this is not something unique to Trinidad and Tobago. It's something that hospitals throughout the world, constantly battle with. The resulting morbidity or mortality, the resulting deaths from nosocomial infection is also not unheard of. It's not unusual. The unusual thing in this case is that it took 7 babies to rapidly deteriorate, leading to death over that short period of 4 days. That has really caught the nation and also the international community, because if one only was to search this particular story, it's on the news of nearly every major media house. So this is a development that the world over is really paying attention, and how we treat with this situation going forward, I am supposing would also be followed up internationally. So we must be mindful how we deal with this situation. So 7 babies dying so soon, one after the other, is really a cause of concern. And we would really want to know, following this investigation being done internally by the Northwest Regional Health Authority and the Ministry of Health, and also externally by the parties named by the Ministry of Health, we would really want to know, understand the sequence of events that would have led to this. Now, the association is aware of certain information, and we expect it to come out within the investigation, which we understand would have transpired that caused this scenario. So we would wait until the findings of the investigation, but we are aware of certain information.
What would be normal protocol, Idi? I'm presuming that from one of the newspaper reports I read, that a baby, a neonate, may have been brought from a private institution carrying the infection into Port of Spain. I can't confirm that because it has not been confirmed. But in any case, if that is the way the bacterial infection got in, or even through another method, another modus, it would mean that one baby came in with showing symptoms of being infected, another baby would show symptoms. Would it be normal for it to happen in quick cascade? Would those things happen in quick succession in a neonatal unit area? Because there's not a large area, it's one section, the hospital.
There's a neonatal transfer policy which only came out in 2020, identifying that exact scenario you are speaking about. So if that, and I read the article also, if that is proven to be true, then there was a severe shortcoming and non-adherence to that very policy that only came out in 2022, spurred on by SARS-CoV-2 virus. And the hospital, the Port of Spain General Hospital, if they had followed those guidelines, then they ought to have isolated that baby which came in from another institution. And
what about if the baby wasn't symptomatic at the time?
It matters not. You were supposed to isolate that baby prior to introducing it to the rest of the environment to prevent exactly what has transpired. A matter of fact, even if it came from another institution, it came from home, and it did not utilize the approved methods of transfer, of interfacility transfer. If it used a private vehicle, you are supposed to quarantine that baby, as it will isolate that baby in another room before you introduce it into.
Who's responsible for ensuring that that protocol is executed?
There are so many difficulties with this, because we would place the onus on the medical chief of staff to ensure that this is done. The medical chief of staff is ultimately responsible for clinical issues like these, especially transferring of babies. The medical chief of staff would have been informed and ought to have ensured this scenario does not occur, and if this is proven to be true. Persons ought to also know we are very short. In fact, we probably only have 2 or possibly 3 neonatal consultants in Trinidad and Tobago. So that very department which we are speaking about, we actually do not have the requisite number of specialist neonatologists in Trinidad and Tobago to manage that ward, and we actually have to utilize one doctor to do consultation throughout Trinidad and Tobago. So the same neonatologist, and I suspect it's Dr. Marlon Timothy, has to consult at Port of Spain General Hospital, has to consult at San Fernando General Hospital, has to consult at San Fernando General Hospital. So we are very short in that dynamic. So there's a number of factors at play. If you don't have...
Idi, who would have had the responsibility of informing the medical chief of staff that a baby is being transferred? Who would have had that responsibility?
Well, it would have been the consultant, but again, that consultant is not only attached to the Port of Spain General Hospital. That consultant, in fact, he only comes there 2 days per week to do his consultation. So we really and truly can't blame the consultant if he's not there on a full-time basis. It would really be inappropriate for us. But
there are several people on the chat asking about there are several people in the chat asking about the responsibility of the nurses on duty and what their role should be in a situation like this.
Because I was going to get their poll in that I was trying to find out, because you said we can't blame the consultant. Fine, I accept that. We can't blame, well, you said that the ultimate responsibility is the medical chief of staff, but then the medical chief of staff was not actually there, I'm guessing. So the person who that they would have interacted with in a case like that would have been the nurses on duty at the point in time. What would have been the responsibility of the nurses on duty at that point in time when that baby came to the hospital? If we are agreeing that this is the scenario that played out.
Well, even before we reach the nurses, and I will deal with the nurses comprehensively, the policy dictates when any neonate is transferred from institution to institution, the physician of the sending institution is the one to hand over to the physician of the incoming institution. So if the information is true in the article, then the physician should have accompanied that baby in an ambulance, hand over all of the information to another physician in Port of Spain maternity block. And that physician, whoever took over that baby, ought to be the one to inform the medical chief of staff. In fact, even before the baby actually reaches the institution, that baby ought to, that physician would have received all of the information from the baby in any event. So it ought not to be a surprise showing up on the doorsteps of Port of Spain Maternity General Maternity Hospital with this infection, and you are now going to scramble to try to treat this baby. Let me also say, within the health sector, you cannot refuse admission of any patient whatsoever. So all patients must be treated. So they just have to have the protocols to be able to treat it.
Right. But Idi, let's assume that the physician or the transferring agency didn't know about anything about an infection. There is still a protocol in place.
Correct.
Right.
And
so
that
so forget the infection for the time being. The protocol is that the baby comes and that the baby is isolated. Who would be responsible for that isolation at the point in time that the baby reaches the hospital?
Well, again, the doctors who are on the ward will ensure they are placed in the relevant isolation room. Whether or not we have enough space to do that, as persons will know, while there's massive reconstruction for the central block, the maternity hospital is a standalone facility, and it's one of the oldest facilities. In fact, the remaining of the building really is unfit to be treating mothers and babies at this time, in my opinion, and in many others' persons' opinion. The neonatology section, which is on the ground floor, was refurbished, but the remaining of the building is totally inadequate. And even that section still leaves a lot to be desired. So, and from the information we have, that building would remain there. It is not that it's going to be incorporated into the new central block. So that's another issue. But again, when we come to the nurses now, and this is why we will be issuing our press statement on this matter. Because one of the fundamental things we are seeing is that because more and more senior nurses are leaving, we have more and more junior nurses who may not have the experience, may not have the confidence to challenge some of the actions of doctors. You really build up that confidence over time to really be able to challenge a doctor respectfully and let them know, look, you are breaking protocol and you ought not to do this. So we want to re-engender that spirit of confidence within the nurse to say, look, you can stand your ground. We understand nurses may be apprehensive about this because we have several instances where nurses are disciplined if they do not follow the instructions of medical staff. We have several incidents. In fact, I was a victim of that when I stood my ground against the medical chief of staff at the time in St. Anne's Hospital about an admission that was breaking protocol. And surely enough, within a matter of hours, my nursing administrator disciplined me and actually transferred me.
So let's presume the nurses were reluctant to challenge if a protocol was broken, because we don't have that information yet.
Yeah.
What will be the nurses' responsibility? Because I'm sure the nurses are the ones on the floor monitoring the neonates.
Yes.
Right? And they would certainly be taking their temperatures, looking at their general physical condition, seeing if anything seems off with these babies. What would be the process in terms of those vital statistics, vitals from the babies, moving to the attending consultant and up the chain if one baby is showing symptoms of a bacterial infection, 2, 3, over a 4 or 5 day period? And what sort of alarm bell should be set off under those circumstances?
Well, there are standard protocols, and whether or not the baby has an infection or showing signs and symptoms at the present time, there are standard reporting responsibilities for the nurses, an ongoing mechanism where you constantly check for signs of infections, the fever, the high temperatures. So if the baby is performing the duties of that particular child's age, because we must remember all of these are preemie babies, they are not full-term babies. And from the information put out by the Northwest Regional Health Authority, the baby was less than 32 weeks. The viability age in Trinidad and Tobago is 28 weeks. Internationally, it's 26 weeks. So you would be meeting certain targets at particular levels, and if you are falling short on those targets, then the intervention of the team. But again, ICU, and this is an ICU, this is an ICU for neonates. It is constant monitoring. So we highly doubt there will be a shortcoming in the constant monitoring of all of these babies, and that is why it's so alarming that one would have.
But 7 and 5 days means that more than one baby will be showing symptoms on a continuous basis. At what point should the authorities or those in charge realize this is a bacterial outbreak? Because it seems to be moving from one neonate to another, who are by nature, by definition, vulnerable.
Yes. So once the babies, so if you bring in an infected baby, as we say, just assuming, and that baby is not quarantined, the layout of the facility, and it is overcrowded. When we speak about overcrowded, each cot or each incubator or each bed, as it will, is not the required 7 feet apart from each other. And you don't have the required number of nursing staff, something again the association has been bringing to the fore in the public domain. And each nurse now is required to see about not one baby as the protocol dictates, but 2 or 3 or 4 or 5 babies at the same time, which we suspect happened. Then you have a higher chance, a higher probability of the infection moving.
Is that what was happening? From your information, is that what was happening? Is it that the cots weren't 7 feet apart, as is international best practice? Is it that more than one baby was being attended to by one nurse? Can we confirm that from your information?
We would want the investigation to deal with those matters, but from our limited information, and this is third-hand information, we understand that is what transpired. And it only takes the baby to become infected, and then that's it. Your battle now has just gotten 100 times worse. And now, even when you discover the baby has been infected, it is already too late, especially for these preterm babies, and that's the issue. And Northwest would have put out that there were other babies who were able to be discharged, who weren't infected, and they were sent home or placed on other wards or discharged to another institution. So it demonstrates that it was isolated in a particular area, and one could sadly appreciate some of the circumstances that would have led to that.
Idi, is it possible for the bacteria then to be spread based on what may have occurred, that one nurse was attending to more than one baby, is it possible that the bacteria could be spread by the adult person moving from one baby to the next?
Yes, it is possible. We don't know what transpired in this situation, and we may never know. But there are certain, when you watch the literature internationally, they would identify these things. You having more than one nurse between babies, highly likely there. And if the cuts are too close together, you could end up with just brushing up against one cut. You go to do something else and you brush up against another cut, and something simple as that could cross-contaminate. But then there's the larger possibility where the medical staff, the doctors, inserting the IV access into these babies, because they spoke about a blood-borne infection, and that is another area where the infection can be spread if the doctors are not washing their hands and not doing the needful. That is another higher likely chance of where this infection could be spread. Because the issue of shortage of nursing staff and the spacing of cuts is an internationally identified cause, a risk factor, but even a bigger risk factor is doctors inserting some of their any invasive device, whether it's the tracks to assist the babies to breathe, the ventilation, whether it's the IV access, whether it's the subclavian IV access, what have you. It is a high chance, a high possibility that the infection can be transferred in that manner.
Idi, quick question. The area where the babies are, is it CCTV monitored?
I know the external areas are monitored. I'm not sure about the actual unit inside of the actual units where the babies are, and I doubt it.
Why? Why not, though?
Because of patients' privacy. Even though they are babies, I guess they would still have some privacy issues, and it would be. I'm not sure, but I know there are persons entering and exiting the department itself. There are cameras there, but I am not sure about the inside of the ward, because I'm the only other area in Trinidad and Tobago where you actually have cameras on the ward itself would be St. Anne's Hospital, for obvious reasons.
But I would think a ward with babies, for obvious reasons, should have CCTV cameras.
Yeah, but
that's my thinking.
But you have the department. For you to leave the department, you will have the cameras there. So, so just in case somebody is leaving with a baby, you would see who is coming in and going out.
For
the actual ward, I'm not too sure. I could be wrong, but I'm not too sure.
We run out of time, Idi. Is it to your memory, your recollection? Is this the most number of neonates or babies to die in such a short space of time? Is this unprecedented?
Yes. This is the first from my memory. There have been instances over the years in San Fernando General Hospital, in Mount Hope Women's. So two of the larger hospitals also have faced this issue. So it's not a new issue. In fact, research was done in San Fernando and in Mount Hope Women's. And on both occasions, they identified something simple as hand washing techniques would have fallen down, basic precautions were not followed. And also the research that was done in San Fernando highlighted the shortage of nursing staff to be an issue. And that research was done in 2001. And it highlighted that issue and encouraged departments to be properly staffed to prevent this scenario. So it seems that we have not learned anything in the 23 years since that particular research came out, and we are still in the same position. We know the Health Ministry and the RHA would put out their releases. Unfortunately, it would not be a truly independent investigation because we just don't have that institution set up in Trinidad and Tobago. It's another thing that the association has been calling for over the years, to have that health sector accreditation council to come in and review institutions on an ongoing basis and not wait for when a tragedy happens and you are now have a jerk reaction. So hopefully this scenario would be the catalyst for the Ministry of Health to start looking at that health sector accreditation council. Yes.
Idi, thanks a lot.
That would be fair. Yeah.
We appreciate you being with us this morning.
Yeah.